Hi, I'm Seraphina, and today I'll tell you a little bit about fluoxetine. We'll go over its history, mechanism of action, intended and off label uses, side effects, and contraindications. Let's get started. History. Fluoxetine was developed based on the serotonin hypothesis of depression, which said that depression is caused by low levels of serotonin in the brain. There were existing antidepressants on the market based on that hypothesis, but they had problematic side effects. So, researchers sought to make another antidepressant that was similarly effective without significant adverse side effects. Eventually, they produced fluoxetine, which was synthetically produced by pharmaceutical company Eli Lilly. It was approved by the FDA at the end of 1987, available for common use by 1988 under the brand name Prozac, and is now the most commonly prescribed SSRI. Now, you might be wondering, what the heck is an SSRI? Well, fluoxetine is part of a class of psychiatric drugs called selective serotonin reuptake inhibitors, or, yeah, you guessed it, SSRIs. These drugs increase the activity of the neurotransmitter serotonin in the brain by inhibiting reuptake. Let's look at what that means. Here, we have the presynaptic neuron, which sends a message to the postsynaptic neuron. The space between them is a synaptic cleft, and that message, well, that's a neurotransmitter serotonin, these little green things. Normally, when there is an excess of serotonin in the synaptic cleft, these transporter proteins transport excess serotonin back into the presynaptic neuron. However, SSRIs inhibit that process, so there is more serotonin in the synaptic cleft, which causes a decrease in depressive and other problematic psychiatric symptoms. Okay, so based on that, what is fluoxetine supposed to do? Well, fluoxetine is supposed to increase patients' mental and emotional well-being by decreasing the severities of the symptoms of a variety of disorders. One of which is major depressive disorder, or just depression, which is marked by extreme sadness over an extended period of time. Fluoxetine is also used to treat anxiety disorders, which are marked by excessive fear and stress. Moreover, obsessive compulsive disorder, or OCD, characterized by obsessions and compulsions, is also treated with fluoxetine sometimes. Fluoxetine is also used for premenstrual dysphoric disorder, which is basically very extreme premenstrual syndrome symptoms. Finally, fluoxetine is commonly used to treat bulimia nervosa, an eating disorder characterized by binge-purge cycles. Alright, so that's what fluoxetine is supposed to do, but there are some off-label uses of it too. It can be used in combination therapy with olanzapine for patients with bipolar I disorder. However, it cannot be given by itself to these patients because it can increase mania. Fluoxetine is also sometimes used to treat a variety of other disorders and ailments. Many of these are learning and psychiatric disorders, but it also treats sleep disorders, obesity, and some male sexual dysfunction. Unfortunately, fluoxetine can be abused for its stimulant effects and by patients desperate to reduce suffering caused by depression, anxiety, or other psychiatric issues. Now, fluoxetine can do a lot of good, but it does have side effects. The common side effects, which are often temporary, include unusual dreams, gastrointestinal upset, fatigue, headache, dizziness, flu-like symptoms, rash, and sexual dysfunction. The rare and serious side effects include allergic reactions, initial increase in suicidal ideation and attempts, serotonin syndrome, mania, low sodium, and seizures. Now, based on those side effects, who shouldn't take fluoxetine? Well, you shouldn't take fluoxetine if you're pregnant, breastfeeding, or trying to conceive, or if you have glaucoma, a history of seizures, history of allergic reactions to SSRIs, a heart problem, diabetes, a history of mania, liver or kidney problems, low sodium levels, or if you drink alcohol or use recreational drugs. Fluoxetine also has interactions with several other medications, including other antidepressants, antipsychotics, triptans, buspirone, lithium, anticonvulsants, St. John's wort, amphetamines, opioids, certain antibiotics, anticoagulants, and certain medications for irregular heart rhythms. Well, that's it, folks. I hope you enjoyed learning about fluoxetine. We went over its history, mechanism of action, intended uses, off-label uses, side effects, and contraindications. Thanks for listening, folks.